Hi, this is Mary Nipper with Aloha Spirit Yoga. I'm going to be demonstrating a beautiful practice of pelvic tuck, which is the most healing thing that I can do for my low back. It's really helped to strengthen and stabilize my low back, so I no longer have back pain. Now, if you're currently experiencing back pain, you should check with your healthcare provider before doing this exercise or any other exercise program. But this should be very, very safe for most people. And also, I just like to invite you to try it out and see if it works for you. So it's very simple to set up for this pose. The only prop that you may want to use is a small rolled blanket or towel to support your neck when we get into the pose. Okay, well, let's begin.
Lie down on your bed or mat and come into constructive rest pose. In constructive rest pose, your knees are bent and your feet are placed about hip width apart. If your chin is tilting up toward the ceiling, lower your chin so your neck is aligned with your spine. You can place a small rolled towel, blanket, or pillow under your head to support your cervical spine. We're going to start with some full deep breaths to relax our body and connect with our breath. This is called full abdominal breathing. The simple breathing practice brings more vital life force or prana into your body. As you inhale, expand the belly. Notice that your body maintains the lumbar curve during inhalation. You can put your hand under your waist to feel your lumbar curve. Now remove your hand. As you exhale, the belly hollows out and the lumbar spine touches the floor. Now see if you can get into a flowing rhythm with your breath. Inhale, expanding your belly like a balloon. Exhale, softening the belly and letting go of tension in your body. If you're experiencing any sensations of discomfort in your lower back, send the breath into that area during your inhalations and release the pain as you relax during exhalations. Now see if you can make the flow of the breath very smooth. Try to make the inhalation and the exhalation equal in length. Continue to tune in to your natural breathing rhythm as you slowly fill the belly on each inhalation and draw the spine toward the floor on each exhalation. Next, we'll add a lower belly strength building exercise. Inhale slowly. Exhale slowly. At the end of the exhalation, contract the muscles around your navel as you draw the navel in towards your spine and gently press the spine into the surface you're laying upon. This is pelvic tuck. Notice how your tailbone is slightly lifted in pelvic tuck. Now relax. We'll do this breathing exercise twice more. Inhale, expanding the belly and restoring your lumbar curve. Exhale, releasing the breath and feeling your spine lengthening. Without breathing, contract your belly muscles. Gently press the spine toward the floor. Good. Inhale again while expanding the belly. Exhale, lengthening the spine toward the floor. Now draw the belly muscles toward the spine and the spine to the floor. Relax and return to normal breathing. Notice any sensations in your low back and in the area around your navel. What do you feel? Next, I'll demonstrate low bridge pose. Prior to doing bridge, remove any prop from under your neck. We don't want to overflex the neck during this practice. This yoga pose will strengthen your glute muscles, which are the large muscles of your buttocks. While doing this variation of bridge pose, keep your hips on the floor for the first breath. Please watch while I demonstrate low bridge the first time. As I inhale, I expand the belly. I exhale into pelvic tuck. During the second inhalation, I maintain pelvic tuck and slowly lift my hips off the floor. As I exhale, I slowly return my sacrum to the floor. Now, please join me. Place your hands by your hips to begin. Make sure your knees are bent and your feet are hip-width apart. Your feet should be about 12 inches away from your sitting bones. Leave your low back on the floor as you inhale, expanding your belly with breath. Exhale as you draw your spine to the floor into pelvic tuck. Inhale as you slowly lift your back off the floor. Lengthen your low back and squeeze your buttocks muscles as you lift. Now exhale as you slowly return your low back to the surface you were lying on. That is one cycle. Relax. We'll continue through 2 more cycles of the 4-part bridge. Leave your low back on the floor as you inhale, expanding your belly. As you exhale, draw your navel towards the spine and your lumbar spine to the floor, coming into pelvic tuck. On your next inhalation, slowly lift your tailbone off the floor, maintaining a long spine and engaging your buttocks muscles. On your next exhalation, return your spine to the floor, 1 vertebrae at a time, starting at the top and then releasing your tailbone to the floor. Leave your low back on the floor as you inhale, expanding your belly. As you exhale, draw your navel towards your spine and your spine to the floor, coming into pelvic tuck. On your next inhalation, slowly lift your tailbone off the floor, maintaining a long spine and engaging your buttocks muscles. On your next exhalation, return your spine to the floor, 1 vertebrae at a time, starting at the top, and then releasing your low back to the floor. Now rest and let your breathing return to your normal rhythm. Take a few deep healing breaths through your nose. On your next exhalation, draw both knees into your chest. You can place your hands on the top of your knees or under your knees as you gently pull your knees towards your chest. You can also spread your knees apart to make room for your belly. Slowly steer the knees into circles, going in one direction, and then going in the opposite direction. After stretching out your low back, when you're ready, you can slowly return both feet to the floor and rest. Enjoy this strength building practice as often as you like. Check for more videos to support strengthening and stabilizing your low back. You can choose playlists to view all the videos on this topic. If you found this video helpful, please like, subscribe, and hit the bell icon.